A recent health ministry study finds that people whose COVID-19 vaccinations are not up to date are 5 times likelier to fall severely ill. Health Minister Ong Ye Kung is urging the public, especially seniors 60 years old and above, to get at least 1 vaccination a year. He adds that people should be taking precautions like wearing a mask in crowded places. And that's because Singapore is going through a COVID-19 infection wave. And he says more people are expected to fall sick in the coming weeks, and hospitalisations may go up. Daily cases rose to 2,000 in the past 2 weeks. That's double from 3 weeks ago. The cases are mostly driven by the EG5 and HK3 variants.
We have no plans to impose any social restrictions. We will treat this as an endemic disease, which is in line with our strategy, and we will live with it. After all this, there has been no evidence to suggest that the new variants are more likely to lead to severe illnesses compared to previous variants. And all indications show that the current vaccines continue to work well in protecting us against severe illnesses if infected by these new variants.
Local clinics have also noticed a rise in COVID-19 infections. One chain reported up to 30 cases a day at each of its 3 branches. That's a 2-fold increase from a month ago. But its medical director says symptoms remain mild and are similar to previous variants.
Cough, runny nose, fever and sore throat. These patients usually have stable vitals and good saturations, not requiring any oxygen supplementations. And most patients are then able to be safely managed in the community by general practitioners and family physicians, especially with the ability of oral antivirus such as Paxlovid.
Dr. Say is also urging people to get updated vaccines, especially those who are vulnerable. They include those who are not fully vaccinated and patients with existing lung conditions or compromised immunity. Doctors say they may suffer from more serious complications if they are infected. Dr. Say estimates this group makes up less than 5% of patients.
This patient usually presents to us with shortness of breath, lethargy, loss of appetite, functional decline, or even falls secondary to lower limb weakness attributed by the COVID-19 infection. So this vulnerable group of patients may have COVID-19 infection complicated by a pneumonia or chest infections, who may require oxygen supplementations and intravenous COVID-19 therapeutics.